Hello everyone, welcome to today's class. And in this class, we are going to understand natural and unnatural death. Again, it comes under Thanatology. So, natural and unnatural death. So, let's understand one by one what is natural death. Any death which occurs in the course of nature or in the form of natural causes. For example, age, some disease, etc., as opposed to some accident or violence. So, if there is any death which is not a result of some accident or violence, and if comes because of some age and some long term or short term disease, then that type of death is natural death. Okay, a death by nature is caused because of some illness, some internal malfunction of the body, which is not directly caused by the external forces other than infectious diseases. Okay, so that type of death is natural death. For example, if a person is dying from complications from influenza or pneumonia or some infection, for example, for a stroke or heart attack, this is an internal body malfunction. So, sudden heart failure, heart attack, a stroke, it all comes under natural death, and sudden heart failures are the most um, common reason for people's death by natural causes. Okay, what are the unnatural types of death? So, death which result from some external cause, like some injury, homicide or suicide, or some accident, that is unintentional injury. So, there is intentional injury or unintentional injury. In unintentional injury, there is an accident, and in intentional injury, there is homicide and suicide. You can include murders as well. So deaths are not categorized by the natural causes, are categorized under unnatural causes. Simple. Okay. With the help of some examples, we will understand in a better way. So let's see natural versus unnatural death. So death occurs naturally or unnaturally or as a result of combination of causes originating from oneself or from other. While some cases it consists of clear evidence that the death occurred naturally, others require an expert to determine the precise causes of death and combination of causes. Clear? Forensic expert or forensic pathologist have this type of knowledge. The forensic panel, they are able to assess whether the person death is because of some natural causes or unnatural causes. To do this, experts must be familiar with external stresses and other poisons or noxious substance or environmental diseases to understand the situation. Okay, as well as the subtle ways in which these stressors affect the body. The expensive panel are trained in the detection of unnatural causes of death, regardless of whether the identity of the body is known or doubtful or questionable clinical history of that disease. Here we have some example. For example, an old woman aged 87 dying in her bed at the night while sleeping after saying goodbye to all the children's and grandchildren's over a period of illness which lasts for 6 months. This is natural type of death. 17-year-old female who dies in a car crash in which she goes headfirst through a windshield of a car that sustained fatal wounds on her face, skull, and brain. This is unnatural cause of death. A 6-month-old who dies from SIDS, that is sudden infant death syndrome, in that crib, it is natural cause of death. Then we have 58-year-old male with lung cancer sustained a machinery over 8 months, finally develops pneumonia in the hospital and dies. This is natural cause of death. So, with the help of important characteristic features, we can identify natural and unnatural causes of death. And in case of unnatural causes of death, investigation is required to identify the real cause of death if that real cause of death involves intentional injuries or not. Okay. So, yes, everyone, that's it for this class. I hope this lecture is helpful to you. If this is helpful, you can click the like button. You can share with your friends and subscribe our channel for more such videos. Thank you so much for watching this. Have a great day ahead. Take care of yourselves and see you guys in the next class. Till then, take care. Bye.